The Full Exposure Podcast is made possible by Metro Health, University of Michigan Health, and Dr. Peter Hahn in appreciation for the contributions that artists and creative minds provide to our community. Arts and culture are essential to a rich and rewarding life, strengthening our overall well-being and our appreciation of all that we see, hear, and experience. Hey, everybody. Welcome to another edition of Full Exposure with me, your host, Brian Kelly. Today is a very special edition. We welcome Dr. Peter Hahn, who is familiar to all of you in our audience as the Chief Executive Officer of Metro Health, University of Michigan Health here in West Michigan. I thought it would be a great time to have Dr. Hahn on our podcast to discuss COVID-19, coronavirus, and what is happening in West Michigan, and specifically with Metro Health in terms of their efforts to care for our community in the midst of this healthcare crisis. It is unprecedented, as you know. There are all kinds of words that fall short in explaining what is happening around the globe and with us here in Michigan. There are, without a doubt, many things we can be doing practically to ensure the health and safety of ourselves and our families. The primary takeaway from this is the absolute fundamental need for all of us to socially isolate and limit our exposure to others. If you do not need to go out, do not go out. It must be imperative that you stay with your family, stay home, go for walks in your neighborhood, but limit your interactions, as difficult as it may be. If you have children like I do, I have 3 daughters, all of which are very challenged during this time to limit their exposure. They're all healthy, thankfully, at the moment, and we want to keep everybody that way. But it requires some very difficult and vigilant decisions for all of us to hunker down. And if we can flatten this curve, as Dr. Hahn talks about, we will do our healthcare systems here in West Michigan a huge favor by not contributing to any surge, an unnecessary surge of patients influxing into our hospital systems and straining it to the point where we cannot care for those who need care outside of COVID-19. As you know, life goes on. They need treatments for heart ailments, for any other reasons that people might on a normal day be hospitalized. But if the system is overloaded with people coming in with COVID-19, it makes the care of routine and other crises, health crises that people present themselves to hospital systems for care, it's going to be extremely difficult for our region. So it was truly an honor to have Dr. Peter Hahn into my studio for this podcast episode. We did practice safe social distancing. We did not shake hands as we normally would. We distanced ourselves as much as possible during our interview, as well as during a very, very quick portrait session before we sat down to do the interview. I did not want a portrait session to take very long, or this interview, quite frankly. We wanted to give it the time and space it needed to have a conversation about COVID-19, but I also wanted to ensure that Dr. Hahn could return to his duties as Chief Executive Officer of Metro Health as soon as possible. So, with that, let's explore the bigger picture with Dr. Peter Hahn. That's key. You want to hit record on these things, Peter. Try to be professional.
Absolutely.
Especially extra professional for you today.
Appreciate that.
Welcome to you, Dr. Peter Hahn. It's awesome to have you. Our audience is familiar with your name because you've been our premier headlining sponsor here at the Full Exposure Podcast. So thank you very much for your support. And I want to dig into all kinds of things with you later about your career and things. But for now, I just want to, let's talk about the coronavirus and what's happening at Metro. And can you just tee up for us, just in your career, have you seen anything like this in terms of outside of simulations, I suppose.
Right. No, that's an easy answer, Brian. Absolutely no. And I can vouch to the audience that there are only 3 of us in here, and we're pretty distant from each other. But no, Brian, these are unprecedented times. Whether you're a physician, whether you're a nurse, whether, anybody in the public. And so, I think it's a time, though, that we're all galvanizing. We're coming together in spirit, staying apart, right, physically. But no, it's a time that things are changing day by day. And, as we were sort of setting up for this, I was checking my phone, not to be asocial, but because emails and texts are coming in just real time with changes.
Well, and you being the CEO of Metro Health, University of Michigan Health, is, you're quarterbacking this whole thing with a lot of help and experts.
Absolutely.
But just when did Metro Health's radar really go up and start to plan, for our community, because you're such a big part of keeping everyone here healthy. You're a big hospital system here. And when did you get wind of okay, this has my attention now?
Yeah, I think as a healthcare system, just like our sort of sister organizations here in Grand Rapids, all around the state, we've got great plans around disasters and protocols. In terms of COVID-19, really, I think the alarms for us as healthcare systems were taken off probably in about the last 2 weeks. The world has changed in the last 1 to 2 months, but really, I think locally, probably in the last 2 weeks, really realizing the extent of what could happen, and really just also looking at what's happened in Italy, I think has really informed the way we think about it, informed the way that we plan for this. I do want to speak to just the spirit of collaboration between Spectrum, St. Mary's, and us. I'm in touch with my counterparts there regularly. Yeah. And it's great to be working together. But the last 1 to 2 weeks has been really crucial.
Well, I think that's great to hear, because in my industry, there's and as healthcare has expanded in our region, we're a growing, thriving economic regions. There's lots of opportunities for growth for healthcare systems. There's kind of a gloves on, time to put the gloves on and time to take them off. And it sounds to me like, now's not the time to, it's a time to come together and pool resources and talent and keep an eye on our neighbors, whether we're sister healthcare systems, as you said, or just partners in the community.
Absolutely. I think there's, I was on a call with Governor Whitmer and other hospital CEOs a few days ago, and we're all facing the same issues, really, and concerned about the same things. And I think the government has stepped up to make sure that we feel taken care of. But I can't stress enough, really, from a healthcare perspective, how important that term "flattening the curve" is.
Yes.
Right.
So let's talk about that. Just for, I'm hyper aware of it. I have two children with some heightened exposure risks, and so my wife and I's ears been to the ground. But by flattening the curve, I think most people are familiar with that term. But can you just tee it up from your perspective, professional perspective, why that's so important, what it means, and why it's so important?
Right. And I think a lot of folks probably a month ago had never really heard that term. Now it's as ubiquitous as Go Blue, right?
Right.
And it's interesting because really that term, flatten the curve, was coined by a U of M professor, Howard Martell. And it really, he was studying the 1918, that big flu epidemic that really affected this country, and really looking at cities that really did well through it and other cities that did not. And what really became clear is just the significant importance of social distancing to really curtail that big spike in cases. Mm-hmm. And the reason that big spike is so concerning is that as a country, we have a very defined set of hospital beds, hospital providers. For a country of 300 plus million, depending on what you read, we've got about 800 to 900,000 hospital beds. So if there is that big spike, it's going to overwhelm the healthcare system Whereas if you flatten that curve, we can stay within our capacity.
Right. And just to plus on to that, from my understanding, and you can correct me at any point in this conversation, but the idea is not to, we may still get infected, but if we don't get all infected in these huge waves that crush everything, that's really the danger. As you spoke to Italy, maybe you can relate to how the curve was much steeper there and what you've learned from Italy and how that applies to all our efforts to flatten the curve here and limit our social interactions.
Yeah, a little bit of a personal hit for me. I did some of my training actually in Ancona, Italy, and so I'm very aware of how modern that healthcare system is. I mean, it's an amazing healthcare system.
Yeah.
And really to see them overwhelmed by really that curve, that spike, to see their ICU beds just completely filled, to see providers, dying, actually, physicians and APPs and nurses. So that's really informed us. I think that really sounded the alarm bells for us in this country. So this social mitigation has been key to really flatten that curve. I think we're going to really see in the next 10 to 14 days how successful we've been. Hopefully we've been very successful.
Yeah. I think that's concerning. I just, all of us have time to take in various news and articles, and it's hard to sort of duck and weave around what's hyperbole, what's political, what's whatever. But I think my main concern, as yours is too, is just we're just getting to any type of capacity for testing. So
right.
For weeks and weeks now, I remember from a long time, Michigan had no cases, and then we had one. And that was a couple of days.
Right.
And then, now it's spiking. And so to that end, I think as we get more tests, we're going to, as California's shutting down, they're taking more drastic measures. What's the testing sort of resources you have at Metro now, and how are you feeling about capacity to test more broadly other than the maybe a narrow parameters that people have to meet to get tested now?
Sure. So, Brian, I think one thing, though, that folks need to understand is that in general, the vast majority of people who get infected by COVID-19, that is actually quite mild, right? The typical symptoms are fever, dry cough, and then perhaps dyspnea, shortness of breath. And so most people will have a very mild illness, and it's really, our concern is for the elderly, for folks who have an underlying comorbid condition, whether it's lung disease, heart disease. So it's really going to be a small fraction that actually end up getting hospitalized.
Right.
But of those folks, about 20% will end up in the ICU and really with severe disease. So that's the folks that we're very concerned about.
Yeah.
So testing has been limited, but on the flip side, again, because there's no specific treatment for COVID-19, there's no specific antiviral medication, no specific antibiotic. There are studies underway, but right now it's all supportive care. So for the vast majority who have mild COVID-19 disease, really the recommendation is almost the same as for a common cold or influenza. It's to really quarantine yourself at home, right?
Right.
Take precautions. And then for the rest of us, really washing our hands, not touching your face and things like that. So,
yeah. Sorry, I didn't mean to interrupt, but but to that end, that's kind of like getting people to really pay attention is part of the problem, because some people think, well, the symptoms aren't that mild. Most people with normal health things are just going to get a little bit sick and then it'll pass on. But that messaging is great to know that we shouldn't have anxiety about that. It's a more serious disease for 80, 90, 95% of us, or whatever percentage you want to apply. But it's so important for us to limit healthier people who might be asymptomatic or only a little bit sick or think they have allergies or a small cough, seasonal flu, from spreading it to people who are much more vulnerable. And so that sort of mixture of messaging, I know Metro Health's been very clear about those things. But how do we get people to really pay attention who are feeling like this is a little bit overblown or a little bit, too dramatic in the media?
Brian, I really do think people are getting that message. I live downtown and had to get some water and walk to a local store. The streets were deserted, right?
Yeah.
It was almost a little concerning in Grand Rapids, Michigan.
Right.
Think about that. But I think people are getting that message. They are getting the importance of that social distancing, just as you said, because you can feel mild symptoms or maybe have no symptoms, but still spread it to others. And again, if you spread it to somebody who's older, who has underlying disease, I mean, that can truly be very serious and ultimately lead to their death, perhaps.
Sure. Can you talk a little bit specifically about just our community in West Michigan? And you talked about the partnership with your sister healthcare systems being Mercy Health, St. Mary's is what it used to be called, and then Spectrum Health, just in terms of collaboration. And are there what sort of specific efforts are there to help each other through this time as you prepare for probably a likely surge of people that are infected and need some of that respiratory care, some of those more serious symptoms?
No, there's been a lot of collaboration. Again, I talk with my counterparts there pretty often. Just an example would be around the visitor policy. Mm-hmm. We wanted all three of our systems to send a unified message to the community around the visitor policy. When Governor Whitmer first announced it, here locally, it's hard to tell patients' families, you can't visit unless, A, B, or C, and there's some strict criteria around that. So we wanted to send that message out together. We feel strongly that Michigan should also have a shelter-in-place order, just like California has had since Monday, just because, again, just the absolute importance of social distancing. This is the way we're going to stem the tide. Very likely we will see a surge, right? Yeah. How big that surge is, we don't quite know. But the more that we can do this social distancing, I think the smaller the surge that we are going to see.
I'd love for you to speak about Metro Health's staffing and physician care and how they're handling the situation and sort of plans that you've made to be more effective in terms of covering and caring for COVID-19.
Yeah, Brian, the health and safety of our patients, number one, and the health and safety of our employees are of utmost importance and the biggest priority. And so we want to be sure that we're supporting our staff through this, both our clinical staff as well as really our non-clinical staff as well. So we've strongly encouraged, going back the last 2 weeks, that anyone who can work from home should. I mean, pretty much mandating it, in fact. Yeah. Number two, there are clinical folks like nurses and doctors who can't, obviously, and they embrace that. They want to take care of patients. But we want to make sure that if they are exposed, number one, that we can support them. So we've got some very progressive and innovative ways to do that, including really being very flexible with PTO, giving them more PTO. Mm-hmm. We've got something called the STIB bank that, again, provides them more time. We've opened up a childcare facility that obviously we're operating gratis for their children, really utilizing just the best sort of the distancing we can with that. Yeah. We've also had all now clinical staff in the hospital and in the clinics wear masks. Really, the initial guidelines from the CDC, and probably still true now, is that if you've got a patient coming in with respiratory symptoms, we get them into a different area right away, right? Right. They have a mask on, and so when the patient has the mask on, that's very effective in terms of preventing spread. Sure. But I get the concern from clinical staff. We get it, and so we're making sure that all our clinical staff actually wear masks now throughout the hospital, throughout the clinics. In terms of our clinics, our outpatients, we've got 18 sites all around the community. What we've decided to do is to not only obviously protect patients, but also protect our providers. So we have 3 of those 18 sites that will see patients who are coming in with illnesses. We've got a hotline that patients can access that will direct them to the ED perhaps, or one of these 3 sites. But the vast majority of our outpatient visits, seeing physicians and APPs, will be done through digital, virtual. So we were going to do a big launch of our digital platform this summer, our app and everything. We've actually accelerated that.
Sure.
So within the next week to 10 days, that'll be rolled out so that all Metro patients and community patients can access appointments through digital.
Yeah, and that's been a trend that's been onboarding more and more, which makes sense conveniently for this day and age. And then what about like elective sort of like procedures that people might have that aren't mission critical to their particular health, be it a small knee surgery or some things that might be able to put off. Are you recommending that yet for patients, or where are we at?
Yeah, actually, so even going back about a week ago, there was guidance from the Surgeon General in terms of really limiting elective procedures. The difficult thing has always been elective procedures. There's a range, right? There are necessary elective. There are folks with cancer or who are in pain. Whereas on the other side of that range is screening colonoscopies and truly elective procedures.
Sure.
We've severely limited elective procedures. Actually, earlier today, we sent out a memo to our staff that we are not going to do elective procedures, period. And the reasons for that, again, are a couple-fold. One is for that social distancing. Number 2 is because there is a limited supply of things like surgical masks. And it's also to protect patients, right? And right before this broadcast, actually 5 minutes ago, got an email from the state that Governor Whitmer has actually an executive order, again, no elective procedures. So I think we're all on the same page on that.
Well, it just speaks to how unprecedented it is, and then also to prepare for, to be prepared for a surge of things and be able to not have such a high demand on your staff, and because they're at great risk to get exposed.
Yes.
And so it's a really tricky problem. I just can't imagine how are you personally trying to make the best innovative decisions you can and still be able to operate a successful system across the board.
No, I think, for me and for, I think, a lot of us in healthcare, the mantra is put the needs of the patient first. That really does guide every decision we make or try to make. So that's always there to sort of be that northern light. For me personally, it's a little bit more difficult in that my wife and kids are in Portland, Oregon. They're off from school, obviously, because of all the college stuff. But yeah, so I won't be able to go back there for probably quite some time and haven't been. And so it's very real that way.
Yeah,
but
for sure.
it's, the camaraderie you feel with your team, right? The camaraderie that I feel with, again, my counterparts, leaders in other healthcare organizations, I think, means a lot and carries you through it.
So in terms of the campus and your main campus at Metro Health, is there a particular command center or how are you sort of set up as an infrastructure just to deal with that particular campus, and what does that mean? Yeah,
we have an incident command center. It's in the basement of the main hospital, and it's very connected. And we really, I think one of the key pieces of this, Brian, is that our communications to our staff and employees is clear, comes from one source. And so all our communications come from that incident command center. It's staffed by a team of core leaders, whether it's, Penny DeVries and marketing and communications. Our chief medical officer, Ron Grifka, leads that incident command team. And so they meet a few people in person, mostly virtual, twice a day. And so just discussing all the important topics, updates, and rolling out communications.
Well, I even saw Dr. Pai out on media and local news. It seems like you're canvassing as much as you can because you have a large network of patients that are already part of your system. They're looking for information from sources. It's great to see, how much, even that you could spend a little bit of time with us here today on the podcast talking about it. It's just critical, as you've underscored, that it comes from one voice and one direction, so people are confident in what they're feeling and hearing and seeing.
And I think that's the key, Brian. I think people should be confident, right? I think we've done the right things collectively. We will get through this. That's my message to our staff, is that we're going to get through this. We're going to be better for it as a healthcare system, as a leadership team. I have every confidence that, we're going to look back on this, and this will be a tipping point for digital health, for how we approach healthcare in the United States.
It seems to be pointing that way. It really is undeniable. I mean, we really have a tiger by the tail here for a foreseeable future. I mean, just the economy is around just what I do in the creative fields. It's upside down as schools are upside down. There's virtually no part of life or business that hasn't been impacted by this, and that just doesn't happen very much in human history,
Sure doesn't. I mean, I think, there's going to be before and after, right, COVID-19 in a lot of ways.
Yeah. I'd like to talk about one thing, because some people have talked about, they talk about the flu virus, usually has a certain amount of casualties assigned to it and these things. And it's almost this casualness about, these measures might seem extreme because, we have all these other events. People die from heart disease. They die from car accidents. And it's just a false equivalent in my mind. But maybe just impress again why stopping and flattening the curve and the infection rates and things are so important, that we're so focused on COVID-19, right? And it isn't about seasonal flu so much right now. Of course, that's a major concern. But help the audience sort of understand that, puts that argument out there. It's like, a lot of other sort of things cause death as well. How can we impress upon people that this is extremely serious?
So I think, again, that flatten the curve concept is so important in this discussion, because one of the key parts of that is the U.S. healthcare system, and really the world healthcare system. There's a defined capacity right now. There's a defined number of beds. There's a defined number of healthcare providers. COVID-19 spread so quickly. There's so much connectivity throughout the world that if there is that big spike, it will just overwhelm us. And I think that's one of the big differences with, as important as influenza is and other diseases, that, COVID-19 has a much better chance of causing that big spike, overwhelming the system.
Sure. Well, and that's just to speak as this is a separate new event. It doesn't decrease the amount of people who may need ER care for a car accident or for or flu, normal influenza that they might have seasonally, or cancer or whatever. It just complicates those resources and can put additional people at risk that don't even have COVID-19, who are just need health care because this, and it could exacerbate things for people who might normally have a positive outcome. It may not be possible if the system's strained to this point. So I just have seen that an argument a lot. It's frustrating to see, people consistently go back to this trope about, why are we taking this so seriously because X, Y, and Z happens? Well, we're adding an entire layer of ramped up, accelerated demand that we can help to prevent by limiting our interactions and stopping the spread. So That's my understanding.
Yeah.
Does that seem
That's
to be
that's absolutely right. And, the curious thing, not curious, but the thing, Brian, is even with influenza now, we're seeing actually lower rates of influenza given the time of year compared to previous years. And one of the really thoughts behind that is because of the social distancing we're doing because of COVID-19, that it's actually having an effect on influenza spread.
Sure. Well, we're not transmitting all kinds of things now because of our limited interaction. So in terms of what we're seeing, I mean, the United States is just really being able to start to accelerate the number of tests we're able to perform on people who are presenting symptoms. And there's a lot of talk about how difficult it is to get tests and supplies like masks and things that you've already alluded to. So how are you feeling about Metro Health's positioning in terms of supply, masks, tests? What's coming?
Sure. No, I think there's been a lot of concerns around testing, number one, and also, number two, supply of masks. I think in terms of testing, it's really been important that we've followed CDC guidelines around testing. And really, those guidelines have said test people who are hospitalized with respiratory symptoms, number one. Number two, test people with comorbid illnesses or who are immunocompromised and having symptoms. And then number three, test healthcare workers who have been exposed or are developing symptoms. The vast majority of people, again, because symptoms are mild, specific treatment doesn't exist, testing for that group has not been that important. Now that we're finally getting more testing available, more and more people will be tested, and that'll help, in terms of epidemiology, in terms of, contacts and such. Like for us at Metro, we utilize the state lab. And within the next 2 to 4 weeks, we will have the capability to test in-house, and the advantages of that is a faster turnaround. 4 hours versus when we send it to the state, it can take 2 to 3 days.
Yeah.
And Michigan Medicine has started testing in-house 2-3 days ago, and other systems will continue to come online. And so the amount of testing available will greatly accelerate here in the next couple weeks.
Yeah. Well, that's good news. That's great news. Yeah, and then just a supply chain of masks and things and those sort of durable goods that you need in high demand anyway, but especially at this time.
Yeah, that's, China in many ways has been our supply chain for a lot of things, and masks were one of those. And so I think, again, this is a tipping point for this country in the way we think about supply chain. We've been fortunate. We've really worked hard behind the scenes to secure enough surgical masks as well as the N95 masks that are used for airborne isolation. So we're in a good position with that. We're certainly willing to help out others if it came to that. But I think that mask situation is concerning. We follow it day to day. So in our incident command meetings, twice a day, how many masks do we have? How many days supply? We're in a good spot with that, but it is concerning, and I think it's going to change the way I think the whole country looks at, where we get them, how we get them.
Sure. Yeah, and it just underscores the interconnectivity of this world. So we're seeing it play out in a pandemic and how connected we are and how easy it is to transmit things, but our supply chain for simple things and what doesn't matter. It's such a global, tight-knit infrastructure now of how we get anything.
Absolutely.
Food versus, packaging to core supplies. It really just underscores how much we're connected as human beings and how just one little disruption can really create a domino effect that you're quickly trying to
Absolutely
undo the bell. What an honor for me to have you here. And again, thank you so much for the support of this podcast. I really feel great about what we're doing and what we can accomplish together in terms of these types of conversations. So again, thank you, Dr. Hahn. I appreciate it very much.
Thank you, Brian.
All right. Well, my thanks to Dr. Peter Hahn. That was a great conversation. It was eye-awakening. It is also comforting to know the dedication of Metro Health and all our hospital systems in our region to getting us through this crisis. But there's a lot that we can do to help each other and help these systems thrive under difficult circumstances. And as we continue to be under isolation for quite some time, I find great comfort in the arts right now. All forms of human expression, the beauty of the arts and culture through books, cinema, music, just this expression of creativity is something I'm taking great solace in. It's very comforting to know that human beings are beautiful. We should love each other and care for each other. And I hope you have a great week. Take care, everybody. This Full Exposure podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.